Hello everyone, my name is Bacem Mbarek. I am a senior researcher at the Faculty of Informatics, Masaryk University in Brno, Czech Republic. Today I will present our accepted paper in the SAC 2022 conference. Our paper is entitled An Intelligent Blockchain Application for Emergency Medical Services. During this presentation, I will follow this plan. I will start by a general introduction about the blockchain and its application in the healthcare domain. Then I will describe the problematic and the goals of this research paper, and I will mention the contribution and the solution presented in this paper. And I will finish by a conclusion and mention some future works. Let's start with the general introduction. Blockchain technology distribution was seen in October 2008, and it started with supporting the first Bitcoin and cryptocurrencies. But in our days, blockchain is used in many other applications, such as the banks, the insurance, the health and pharmaceutical industry, and supply chain, for example, of many sectors, for example, food industry, luxury, international trade, distribution, many others, like, for example, in energy, let's say, for example, the smart grids application in financial, for example, for trade, financial, and public sectors, let's say citizen identity and medical records in retail, for example, in information sharing, in insurance claims processing, risk provenance, and many others like claims file and manufacturing, maintenance, tracking, and products, parts, supply chain, and many others. In this paper, we will focus exactly in the real-time healthcare application based on blockchain technology that support the life cycle of the patient in healthcare system. The basic idea of this paper is to improve the quality of healthcare system by ensuring a consensus around tests and information about the patient, and by centralizing the prescription system. We collect patient health data by integrating medical IoT devices, and we provide the data access control to restrict access to the granted person. The basic idea is to use Hyperledger Fabric to implement a real-time healthcare application, which is based on remotely monitoring of healthcare. And the general architecture of Hyperledger, it's like that. It's usually Hyperledger Fabric. It's a platform and open source access of blockchain. It's called usually blockchain framework, and it's composed by organizations and some chain codes, and each chain codes contains a channel, and each channel smart contract. For example, organization one, it's composed by two peers, peer 0 and peer 1, and organization 2 is also composed by two peers. To connect two organizations or to communicate between each peer for each in each organization, there is they should communicate through a network or blockchain network, which is composed by many chain codes or different chain codes. It could be one or many others chain code, and each chain code is composed by some smart contracts, which are the authentication way for the communication. Let's see the example of our solution. The example of our solution is to connect smart ambulance with hospital, university hospital. It means starting detecting remotely the information about the patient from the ambulance, and it's remotely application or a real-time application. It means doctors in the hospital or all the hospital staff services, they needed to communicate with the ambulance remotely, and the ambulance could share some data, some tests, some diagnostics, and the hospital, they can prepare everything. For example, doctors can remotely also write some prescriptions, write some write some prescriptions also, or can give some advices to the nurses inside the ambulance. They can, from the all collected data, they can decide whatever they can do. And the use case exactly of the solution is also here the sharing the right, and who can read, who can write, who can get access. And we have three basic channels, which are the prescriptions, the data, and the historic. And the historic is very important. Historic is to know all of information recorded about the patient, and all doctors can follow this historic information to decide which prescriptions he can do, to decide also the problem of that it is shared exactly. Also, the data or the tests which are can be added by the smart ambulance. It means by IoT devices which are inside the smart ambulance, or by the staff of the smart ambulance, could be for nurses or others people inside smart ambulance, or IoT devices or nurses usually like that. And the pharmacists, which is another organization here, which are able to receive the prescription from the doctors, and of course to give the prescription to the to give the uh, or to add some or can validate the prescription to the doctor to the patients. And we have three others organization: hospital, university, hospital, and doctors. And the patient, of course, he can see everything in the blockchain network, but he can't add and he can't write anything. The class model is composed like that. We have a class model for the chain code and the historic channel. We have the worker ID, we have the organization ID, the hospital service ID, the patient ID, the data form, and the details. This is the historic class mode, and the prescriptions class model is also class model for the chain code prescription channel. For the rights for each organization and user, we have the hospital, university, hospital, doctors, and smart ambulances, and pharmacists and patients. Users, the doctor, nurses, IoT, doctor, nurses, and IoT, and students, they have some kind of rights. Who can read, write? For example, here the doctor can read and write the prescriptions. The nurses, they just can read them. But for the who can validate the prescription, of course, the doctor he's able to validate. The nurse is also able to validate. IoT devices are just able to write some information or add them in the channel or in the chain code data. That means if any information detected about the patient, it should be added in the channel. Many rights and here added for each organization. Pharmacists also, for example, they can just read the prescription, but they can read and write the validate prescription. And for the IoT devices, exactly, they are able to detect information and send them to the blockchain network. And here also we added another improvement inside the IoT devices to detect that their information are correct or not. And we have many IoT devices which are deployed in smart ambulance, in hospital, and in university hospital, to check the IoT devices in the smart ambulance, which can add data or test. We add some kind of agent that they have some kind of limit of information. That means the information, if it is added, for example, about they have a limit about the temperature of the body, for example, they have a limit of any healthcare information that should be added. That means there is some threshold about up and down, and they have to add the exact, not the exact, but if it is not in the limit of the data that should be added, it means the IoT device is not working right, or it's attacked or something like that. Then we have some kind of implementation to implement this solution. We used the Hyperledger Fabric. We create our network with 6 organizations that were listed before, and 3 channels, which, as we said, the channels are the historic, the data, and the prescriptions. The 3 channels are the prescription, the channel, data chain, and the historic channel. And the specific environment, we have a virtual or VMware workstation. Pro and operation system, we use Ubuntu, and number of processor 4, number of core processor is 2. The RAM is 8, the Hyperledger Fabric is version 1.1.0, Calibre is version 0.2.0. And for the testing with Caliper, we get some results. We tested the network by varying the send rate, transactions per second from 50 to 150, and we calculate the adding alert, for example, adding banned, added data, added register, query alert, and banned, and query data, and query register, and update alert. And we have, for example, the successful transaction usually is 100 transactions. It means we don't have any failed transaction. And sending rate, it's usually between 78 and 80-30 transaction per second. And average latency, it's okay. For example, for healthcare application, for operation of one transaction, we need per second, we need 344 second, and the maximum is 5. It's okay for healthcare application, like for the treatment for transactions, it's still okay. They are acceptable results. For conclusion of this paper, let's say that the proposed real-time healthcare system is a very important solution for remotely and uh, real-time healthcare application, and it's based on the blockchain platform. It's a distributed platform that means all peers or all members of the network, as doctors, nurses, pharmacists, all of healthcare like organizations, they will be connected in real time to see all information, all shared information about the patient. It means they will have updates like at the same time. And this application, or this is RTH Care, has the potential to improve hospitals' ability to control patients through the implementation and operation of a distributed ledger solution based on Hyperledger Fabric. With the connect permission, the medical staff and patient, ambulance and staff and medical IoT devices, they can see the blockchain content. For future directions, we first plan to improve our model to make it more suitable in the real life by defining more organizations, adding the healthcare authority or the insurance companies. We plan to add a payment channel to centralize payment. The anti-collision system is one of the most important issues, and also we plan to develop an anti-collision routing protocol to solve this problem. That's it for my side. Thanks a lot for your attendance. And if you have any question, uh, please go ahead. We will answer during the by. You can also contact me by email or send me any question by in my email. Thanks a lot and goodbye.